Hello, I'm Dr. Jean Wu. I am a prosthodontist from Newport Beach, California. We're here today to use an impression material that will capture the detail around the teeth and the anatomy for your patient's mouth. And from that, you'll be able to create the treatment plan and then have the aligners fabricated so that the clear aligners will need very minimal adjustment and they'll fit your patient's mouth exactly. What we're doing today is we have the heavy body in the dispenser, and then we'll do a light viscosity wash over the teeth to capture the detail. So here we will be dispensing the material. So here we have the material applied in the tray, and I'll be applying it around the teeth. So if you'd just like to open there for me, Ray. I'm just going to dry your teeth off. You'll feel a little bit of stretching on your lips, but try to keep your lips nice and relaxed, just as you are there, Ray. Excellent. A little bit of stretching. We'll deliver the back of the tray in first, and we'll rotate that in. I'm going to stretch your lips out a little bit of pressure. So Ray, now the impression is set. You'll feel my finger coming in to release the impression and the suction on the back, and then we'll be able to take the tray out of your mouth without too much pressure. A little bit of stretching. Good. And if you just like to stick your tongue out, I'll take out some material. I'm going to suction here for you. So you can see with the impression we have adequate material extending around the wisdom teeth at the back there. The blue material is a heavy body tray material, and the orange material is the light body. And this is where his tori were, so we didn't put too much pressure on the patient in the undercut areas. And then there's adequate extension of the material in the rest of the arch. Make sure we have adequate extension around the wisdom teeth. Here comes the upper material there, Ray. You'll feel a little bit of material coming perhaps down, but don't worry, I'll clean that up there, Ray. There should not be too much excess material. The light body here does not drip, and so it just really stays on the teeth very nicely. And here we have the upper tray. We'll be putting the tray in the back first, and then rotating the tray forward. So you'll feel a little bit of pressure in the back there, Ray. And a little bit of pressure here. Good. And just keep your lips and cheeks nice and relaxed. And you'll notice the patient is in a 45-degree angle. This is most comfortable for the patient as well as for the operator, and it allows us good access to the mouth and good visibility, as well as not too much upright position so that the material just slumps. So this is a good position. You could also sit if you so choose not to stand, and then have the patient again semi-reclined. Sometimes if the patient needs to be assisted, if they're a gagger, I'll sit the patient up a little bit and support the patient behind the head so that they can lean forward if that's more comfortable. So you'll feel my finger just applying a little bit of pressure just to release the tray and the suction. Good. Good, and then it comes out really quite gently and comfortably for you. Excellent. So it looks like we have good detail there of the teeth and the extensions. So there we go. The clear aligners will need very minimal adjustment, and they'll fit your patient's mouth exactly, and therefore you'll get a good result. The patient will achieve a beautiful smile, and everybody will be happy with the result.